of our housekeeping items here. Just as a reminder, this will be recorded. We will send out the handouts and the materials that we're discussing here today, so you all have a copy. Also, if you're watching this as a group, I know some of you like to watch these webinar sessions as a group, go ahead and let me know afterwards so I know to give credit to those who are all watching, even if your name doesn't pop up on the attendance here today. Also, and ask to put the questions that you have throughout the presentation in the Q&A portion of the webinar. So the Q&A box up at the top, there should be an icon next to the chat labeled Q&A. If you could put those there, that would be very helpful for us being able to keep track of those questions so we don't miss anything. And we will hopefully have some time for questions at the end to address some of those questions that come up. But if we don't get to all of them, we will compile all those questions and send out a Q&A doc along with the webinar materials as well. I think that's all of my housekeeping items here for today. Katie, do you have anything to add before we kick things off?
The only thing I just wanted to quickly add was that for those joining, I haven't seen any pop in, but if there's like an AI note taker or anything like that that you might have attached to your account or have sent on your behalf, we do have to boot those out. So just a heads up about that. So that way you guys know I'm not doing it because we don't want you to take notes, but just the state doesn't allow us to have those on our webinars and calls. So.
Yeah, and if you can put any questions, and I see we have a few hands up, if you could put your questions into the Q&A, or if it's more technical issues, if you could put that into the chat, if you're having, troubles with sound or anything like that, that would be very helpful since we do have quite a large group here today. So once again, welcome. This is our first in our SHIP kickoff event for our SHIP program, and I'm going to start with what we're going to talk about today, and then I'm going to hand it off to Katie to give some helpful information to us all. So first, our agenda for today. My goal is to give you some information about what's happening here in Michigan, what's changing, what's not changing, an overview of the STARS program. I'll do some screen sharing and giving some tutorials on the different forms and how to enter client contacts and where to find things, as well as the same with the SHIP TA Center. I'll screen share and show you where to find some of those things, some resources, as well as we'll talk about the annual recertification for counselors as well. So I'm going to go ahead and hand it over to Katie for our first few minutes to talk about SHIP and MIPPA here in Michigan.
Yeah, thank you for, sorry, I'm just putting in the chat. If you have questions please put those in the Q&A box, but if you have tech questions, feel free to drop those in the chat. We'll try and help out because we do have lots of stuff to get through. So we have everyone kind of muted today and just all that good stuff. So feel free to pop those questions in the chat. So yes, just wanted to talk briefly with you all regarding some of the changes that we've had in the program in Michigan. Lots of different things taking place here. I'm sure many of you have been on calls and conversations with us already, but some of you may not. So I may be a brand new face. Jessica, I think many of you have had the good fortune of connecting with before, but you may not have seen me. So we'll do some quick run through of some of our team here at MDHHS, but my name is Katie Alexander. I am the Community Option Supports and Services Section Manager within MDHHS, and we are housing our new No Wrong Door system here in Michigan. So I guess, Jessica, if you want to jump to the next page, I can talk a little bit about that here. But housing the new No Wrong Door system. And that system is actually going to comprise the SHIP and MIPPA programs, as well as our person-centered options counseling program, also known as our long-term services and support. So I know some of you, like I said, have met me before, but so this, I may be a new face to all of you. So if I am, welcome, and good to meet you virtually here in Michigan. So wanted to talk a little bit about kind of what's changed here in Michigan with the SHIP program, and then also talk about just some additional information that will hopefully be helpful to all of you. I know many of you have had conversations with your local counseling sites and your regions, so please continue to have those conversations as we go along in this new process. So as I mentioned, we are hosting a new centralized No Wrong Door system that will comprise our options counseling as well as our SHIP MIPPA counseling programs. And really looking across the state of how why we're going through this is that we wanted to really kind of have a space where, there's, as we say, no wrong door to come in to have conversations and questions for counseling, for Medicare counseling, or for long-term services and supports counseling. And being able to kind of combine these programs, if you will, is really offering kind of the opportunity to expand on the services and conversations that we can have with citizens here in Michigan. So really excited kind of about this process. We just launched this change, I guess you can say, through the start of March and April. So it's brand new, fresh, that we're kind of coming through this process and making some modifications and changes to our system in Michigan. So we're eager and excited to have you all along with us. And I know there's lots of questions, right, and that we've had, and want to make sure we try and address those. So hopefully we can answer some of those for our counseling team here today. There are going to be things that we kind of navigate as we go along too, and questions that we just want to help answer. So we really appreciate you sending those to your team and to us, because we recognize we've got a big change that we've been going through. So wanted to kind of share that information with you as we get started. Additionally, so wanted to share kind of something that will remain the same. So right now, if you guys call that 1-800-803-7174 phone number, that phone number is still geo-routing to the local counseling sites. So just please be aware of that. Want to share that information with you. We are transitioning into some new sites that will be doing some of this counseling. So as we go through that process, we will be moving to a centralized call center who will take that over that number, if you will. So when you call going forward after May, if you call that 1-800-803-7174, you're actually going to get a live person who will then route to the local counseling sites to refer counseling sessions or to schedule counseling sessions directly. So hopefully the idea being that because we are pairing some new programs together, one that these the centralized call center can they can go ahead and kind of take some of that intake and navigate where that call should go. But that also we again have that kind of that centralized place for individuals to call into. Additionally, obviously, we'll still be seeing, local referrals and scheduling and things like that happening at your local sites. So that won't be changing, but want to just make sure you guys kind of know a little bit about what will be taking place as we kind of go through the process here. Do you want to go to the next page here? Awesome. So yes, I mentioned the Community Option Supports and Services section, cost section, if you will. And so, yes, we are a brand new section within MDHHS. And so we are housing our persons or our No Wrong Door system that houses the, that person-centered options counseling and the SHIP and MIPPA programs. So we do have some staff that we are brought on board and are bringing on board. So you'll see some kind of blank spaces here. So I am the section manager, kind of overseeing this section, but very eagerly, excitedly welcomed with Jessica Fleming, who many of you hopefully recognize from MAP Inc. And she is joining us to take on the training and for not just SHIP and MIPPA, for options as well. So we're very excited, and she's got her plate full. So really appreciate having her on board. We also are joined by Amy Harding, who is our SHIP MIPPA grant manager, who will be assisting the implementation agencies through the through the kind of this process, and helping with things like their financial status reportings and work plans and all that good stuff. So all that administrative stuff that we have to do as a agency. And then we are also bringing on a policy analyst, a volunteer manager, and a data analyst to kind of help further. So, we will have some additional support here at the state level to provide to the agencies and to the counseling staff to get them kind of up and running and make sure they're comfortable kind of with everything. I didn't mention this on the last page. I did mean to say this, but I didn't have it noted. And one of the kind of the changes that we have here in Michigan, and I've already noted it as we're talking about it, is that historically, many of you know the Medicare counseling program in Michigan has been known as MAP, the Michigan Medicare Assistance Program. That with MAP Inc. was a proprietary name, so we could not, we couldn't continue that name going forward. So we are using the federal name, which is the State Health Insurance Assistance Program, or SHIP. So you'll hear me referring more to our program in that level, but in a practical sense, we also are utilizing the Medicare counseling program. So sharing kind of that information with you all as well. Do you want to go to the next page? But I think I might be kicking it back to you, Jessica. And if I missed anything, feel free to let me know. Please keep me honest. So
I think I'm up. So thank you, Katie. And just to introduce myself, I tend to just jump into things, right? But there may be some of you who aren't familiar with me. I'm Jessica Fleming. I'm the training manager here for our section. Many of you may be familiar with me from my time at MAP Inc. as the training manager there as well. So I see lots of familiar, not necessarily faces today, but names, and happy to have you all here with me and be able to continue this journey on with you all as we continue to serve our Michigan Medicare beneficiaries. So let's go ahead and get started. So Katie mentioned the SHIP name. So SHIP, fun fact, it actually stands for State Health Insurance Assistance Program. The A is silent. I've been told that SHIP just rolled off the tongue a lot better than the actual acronym here. So SHIP is the name that you'll hear referred to both on a state level as well as a national level. So to give you a little bit of background about the SHIP program, so the SHIP mission should be fairly familiar. This is not a new mission to the Michigan Medicare Counseling Program. So the mission is to empower, educate, and assist those Medicare eligible individuals through our outreach, counseling, and training, both to the communities, our community partners, as well as ourselves. So it provides that local and personalized counseling to our Medicare beneficiaries that are seeking help with their Medicare questions. So providing that personalized input, having someone locally that they can communicate with directly, having that personal connection with those beneficiaries is, I would say, priceless to those beneficiaries. Also, it's a free program. So that is another thing that makes us ever so special, as well as, we aren't trying to sell anything. So just having that unbiased local resource available to our beneficiaries is what we will continue to do. So once again, our primary target populations are going to be Medicare beneficiaries themselves, their families, their caregivers, maybe even other professionals that are helping serve them, anyone connected with that Medicare beneficiary to, in return, help that beneficiary get their questions or their issues answered. So once again, back to what Katie said earlier, this isn't new. SHIP has been around for many, many years, just under maybe a different name than what you were used to prior, but still the same grant, the same rules and everything that goes along with the grant program. So a little fun fact here, there are 54 SHIP programs nationally. So each state has a SHIP program. Each one is built a little bit differently, staffed a little bit differently, named a little bit differently. So if you were to go into the SHIP TA Center website, SHIP Technical Assistance Center website that I'll go over a little bit later, there's a Find Your SHIP button. So every state has a profile essentially in that website to help connect beneficiaries who may be seeking out resources to their local SHIP program. So more to come on that website later. But, our focus is to provide that information to individuals and hopefully helping them walk away knowing a little bit more, feeling a little bit more comfortable about their Medicare benefits than when they did prior. So we'll also mention MIPPA. There's lots of acronyms here, and I'll try my best to spell them out for you. But I believe we're working on some acronym lists to get out to you because there's a lot of them. I'm not going to lie. So MIPPA stands for Medicare Improvements for Patients and Providers Act. Now, that doesn't really tell us a whole lot about what that actually is, right? That is just the name of the act. So I'm going to go into what that means. So MIPPA, the intent of the MIPPA program is to help Medicare beneficiaries with limited income and limited assets find and learn more about those programs that may be able to help save them money on their Medicare costs. So things like the Extra Help program or the low income subsidy program to help them with their prescription drug costs, the Medicare savings programs or the MSP programs that are designed to help with their Medicare Part B premiums, as well as those Medicare preventative services or preventive services that are designed to things like annual wellness visits, immunizations, screenings, to help them stay healthy, help them reduce those costs, and hopefully stay out of the hospital and help them overall stay healthy, and in return, reduce some of their costs, as well as educating them about those free benefits that they have available to them as well. So once again, the MIPPA program and the SHIP program are the two grant programs that we will be focusing on here today. So there are 14 total agencies providing the SHIP and MIPPA program across the state of Michigan. All areas of Michigan are covered throughout the state. So this new list of grantees, the kickoff was April 1st. So some of them may be familiar to you, others may be new to this list. So looking forward to continuing our journey with some of our previous grantees, as well as continuing on with new grantees as well, and welcoming them to our group. And is there anything you'd like to share here or add here, Katie? And this list does not, this is just our primary grantees. So there may, if your agency isn't listed on here as a sub-grantee of one of our primary grantees, we still are forever grateful for you all as well. But that would be a very, very long list to fit onto one or two PowerPoint slides. I think we could make a whole presentation on all the different agencies and what you all do in your own communities as well.
Yes, I was just going to say that, but thank you. You got it. So.
All right, so let's get into stars. I think this is probably the most common questions that I've gotten in the last, what am I, month and a half, 2 months in here. So stars is the national reporting system for the the SHIP program, the SHIP and MIPPA programs. So STARS, let's start off with what does it stand for? So it's SHIP Tracking and Reporting System. So it is exactly what it says it is. It's a reporting system. It's a national reporting system through the Administration for Community Living. And all of the SHIP programs, I mentioned the 54, they all report into this system, the STARS system, in some way, shape, or fashion. So here in Michigan, we will be directly reporting into STARS. Some states have an API system, which essentially means that they have another system that the information flows into the STARS reporting system. So you will notice that information you had reported in the past, maybe into SHIP tools, is in the STARS system because that was flowing into the STARS system. So once again, here in Michigan, we'll be reporting directly into STARS. And I need to give you a little bit of background of what happens to that information. So the information that's reported into STARS then gets reported onto ACL, who uses that information to put together a really big report that goes on to Congress. And what that does is it helps analyze what programs are needed, what are the common issues, and it overall just helps support our Medicare beneficiaries. It helps support the programs and services that help support them, as well as the SHIP and MIPPA programs as well. So I like to think of it as it really tells our story of what we're doing as a state, what we're doing as a national program, as well as it tells those beneficiary stories as well. It helps communicate what's happening with our beneficiaries, what are those common issues, and help support maybe new programs, existing programs, maybe new rules that need to be put out by CMS to help protect those beneficiaries. So it's used for a lot of different things. So, you know, as painstakingly as it can be to report into some of these systems, you know, I don't think any of us get into this for the reporting aspect, right? But it is important and it tells our story and what we do. So that's my little spiel about why reporting is important, but let's get on to STARS. So there is a structure to STARS. So I'll give a little bit of an overview. There's different roles, there's a hierarchy, there's a structure to the build. So when we talk about the national level, up here at the top on this slide, we're talking about the Administration for Community Living, or ACL. So they are the top level in the hierarchy. And then we have the state level, which is going to be, for us here, is the Michigan Department of Health and Human Services. And then the sub-state levels will be all of our grantee agencies, the main grantee agencies. So listed on the previous slide, those 14 agencies. And then the sites below it are going to be their sub-grantees, their community partners that are working directly with them to provide those local counseling services as well. So I'll talk a little bit more about why this is important here. So in STARS, everyone is assigned a role. So based on the hierarchy and where your role fits within that hierarchy is going to determine the capabilities that you have within STARS. So the majority of our team here, the majority of our counselors will be at the team member role. And if you're unsure of your role, I can show you this in a little while when I pull up STARS. It is in the upper right-hand corner of your STARS login, so it will always tell you what your role is there. We are working with ACL to set hierarchy roles based on information that we're being provided from agencies. We've sent out some emails just asking for more clarification on, you know, who your sub-grantees are and what that's going to look like. So your role may change a little bit in the future if there's any adjustments that need to be made. So there are some really great guides in the SHIP TA Center, as well as I have this one linked at the end and the resources here as well. There's a simplified user guide that's very helpful. It gives you a snapshot of, based on what your role is, what capabilities that you have. So for example, a team member role, they can edit their own forms, they can view their own unique ID number if you have a unique ID number, but you can't view others' unique ID numbers, and you can't edit other people's forms. You can conduct searches and advanced searches, so you can search for information that you've entered into the system. Like I said, you can't edit other people's forms. You can't edit your own team member form, so you can't adjust your own form. We would have to assist you with that. So if you have updated email address, or we update your status, we can handle that for you. So if communicating with your program manager and us to get that information, you can't access reports or delete data. So kind of gets down to that quality assurance piece. So make sure if you do accidentally put something in that shouldn't have been put in, just let us know and we can get that deleted, but you can't delete your own data. Some stars help, some helpful information. So a few different pieces here. So team members who have not received their username email, hopefully you have by now. It should have come from the email address here on the screen, this do not reply ACL systems. If you did not receive that, or you have questions about that, you can contact Katie or myself and we'll confirm the email address that you have on file with us is the correct email address, because the email address that was originally put into the STARS system may have been quite a while ago. If you've been a team member for a long time, that would be the email that it had gone to. And it should have came in 2 separate emails. There should have been like a username email as well as a password email. So if you didn't receive your password email, you can reach out to the STARS help desk through Booz Allen Hamilton. That is the organization that ACL partners with to provide that technical assistance and to administer the STARS program. So if you're locked out, tried too many times, it's happened to me, they are pretty fast at getting that password reset. If you just shoot them an email, they'll get that reset for you. However, if you are locked out due to the 120-day rule, so what the 120-day rule is if you have not been in STARS for 120 days, the system's automatically going to lock you out and set your account to inactive. So if that happens, you'll need to contact Katie or myself to reactivate that account for you. So make sure you're logging in frequently to make sure you aren't getting locked out to that 120-day rule. Also, to add to that 120-day rule comment there is, if you have a CMS unique ID, you will need to enter a beneficiary contact at least every 120 days, or else that will cause the unique ID to go inactive as well. So if you have any questions about that, once again, feel free to reach out, and as well as I'll show you where to find some of that information in the SHIP TA Center. There's a lot of really helpful information, job aids, infographics. I'm in there all day, every day, learning more and more and more. So I'll show you some of those tips and tricks of where to find some of that information as well. So one of the go-to resources that we have is the STARS manual. It's a very comprehensive manual. Once again, one of those items that I use all day, every day to look up questions or just get some more guidance on what is available. So there are 9 total chapters split by topic. It's found in the STARS resources section of the SHIP TA Center, which once again, I'll show you where to find that here in a little while. But it's very helpful. There's guidance, rules, step-by-step instructions, and it is updated annually. So it is continuously updated as more and more information goes out or as things are changed within the system. So it is split up by chapter currently, but I do know that they are working on a combined version. So hopefully soon there will be a full 9-chapter PDF version available if that's your preference. It is searchable, it's a PDF, so it's clickable, it's searchable, so you can find that information in there easily and reference that specific section. So throughout this next little bit of slides, I will reference the different chapters of the manual where you can find additional guidance and helpful information can be found as well. So you'll frequently hear me refer to the STARS manual and the chapters in which I find the information, or you can find the information within that as well. There's a lot of charts and infographics. Once again, very, very helpful tool to be able to utilize. Get into the good stuff. So entering client contacts, and I will pull my screen up here in a moment, but just to get us started on a few things. So you may have noticed that there are 2 different types of contacts in the beneficiary contact form. So first you would start with finding the tracking inbox, and you would go down to the beneficiary contact, that option number 1. So there are 2 types of contacts that you can enter. There is the BCF, which stands for Beneficiary Contact Form. And I'll just start with, it's never wrong to enter a beneficiary contact form. You can always just do a BCF form. So for example, you help Paul with his Medicare Part B enrollment and after he retires, and then 6 months later, he calls during open enrollment to review his plan options as he's looking at alternative options or just making sure the plan that he enrolled in 6 months ago is still the best plan as new options come out. That second call is going to be a BCF. So that would be a beneficiary contact form. On the other hand, there's also a beneficiary additional session, which is BAS. This is going to be a follow-up on that same issue. So for example, we have Sally, we're talking to her about her Medicare Part D plan options. And then 2 weeks later, she follows up on that appointment to enroll in the Part D plan. So it's still an ongoing of that initial call with her. So you had the initial appointment with Sally where you reviewed plans, you went through the options. Maybe she took them back and thought about it for a couple weeks, and now she's coming back to enroll in a Part D plan. She's made a decision. So that follow-up appointment can be entered as a beneficiary additional session. So that would be a follow-up to that initial contact with them. There may be multiple beneficiary additional sessions. You know, it may take multiple phone calls, multiple appointments to resolve that issue. There can be as many as there needs to be. But if she were to call back 3 months later with a new issue, maybe she lost her Medicare card and needs a replacement Medicare card. That would be a beneficiary contact form, a new BCF form. And as promised, there's step-by-step instructions and additional guidance on the beneficiary contact forms, entering beneficiary contacts in Chapter 4 of the STARS manual. So why don't I go ahead and I'm going to pull up STARS, and I'm going to just log in here real quick because it does time out. It will give you a warning every 25 minutes if you haven't touched it. And I've been talking for more than 25 minutes, so it has timed out, and it will automatically time out after 30 minutes. Okay, so I am logged into STARS here, and it should look something like this on your screen when you log into STARS. And as I mentioned earlier, it will always tell you up here in the right-hand corner what your role is. So if you're a little unsure of what your role is, that will show up there in the corner. And the usernames are automatically generated based on the individual's name. So mine is jessica.fleming1. So that is automatically created by the STAR system to match that information. And so up here at the top, we have some of our tabs. So I was talking about the tracking inbox. I'll talk about a few of these options here today. So we're going to start with beneficiary contact. So if you just hover over beneficiary contact, it's also going to give you new beneficiary contact. So you click that button and it's going to give you the opportunity to enter a new beneficiary contact. So you would enter the data contact. You can either type in the date here, or you can use the calendar option to select the date. You can't select something in the future. If you try to select something in the future and submit it, it's going to give you an error code. So throughout this process, if there's something that's not right, it will give you an error code at the end. So for example, if you select MIPPA, yes, and then you don't select the appropriate topics discussed, it's going to give you an error. So it does give you some of that feedback and lets you know when you've entered something incorrectly. And for this send to SMP, we will say no, because we are not connected to the SIRS system. We are not currently an SMP program, so this will stay as no, but you do have to answer all of the questions with the red asterisk. And once the contact has been saved, it will give you a ship reference number. This will be blank to begin with, but if you were to go back into this contact form after it's been saved, that ship reference number would be there and available, which can later be searched by if you're looking for that specific contact, but that's not the only way that you can search by as well. You'll enter the zip code of the location, the state, and the county. The beneficiary information, so their first name, last name, phone number, email address, if they have a representative, if they have someone that you're working with on their behalf or alongside of them. You can also enter their information as well. So the zip code of the beneficiary residence, state of beneficiary, county of beneficiary residence, you can check for all of that, or you can enter all of that. And then this check for duplicate records, this is going to, it's not going to tell you if that beneficiary has been entered into the system before. It's going to tell you if that beneficiary has already been entered for that day. It's going to help you check to make sure that that entry hasn't already been entered. This is especially helpful if maybe you have someone who's doing data entry and checking to make sure that that hasn't already been entered as a duplicate record. How did the beneficiary learn about SHIP? So lots of these are drop downs. So if it has an arrow next to it, you know it's a drop down, or it could be a text box as well. The method of contact, their age group, their sex, the beneficiary race, is English their primary language? Are they or a family member part of the military, or have they ever served in the military? Is their monthly income and assets above or below that federal poverty limit? And are they receiving or applying for Social Security disability or Medicare disability? Next, we have the topics discussed. Hopefully these look very familiar to you. Once again, the SHIP tool system had flowed into the STARS system. So all of these should be very familiar with you. Hopefully none of these are a surprise to you. Hopefully you've seen all of these questions before in the past. It just looks a little bit different. So all of the same topics discussed. So based on the category, so you can look for the different category that you're talking about. So let's say you're talking to them about Medicare Part D, and you talked about, you did a benefits explanation, maybe you did a plan comparison with them. So you would check the appropriate boxes, but then also during that conversation, you talked with them about, maybe Medicare Advantage. So maybe they were weighing their options between Medicare Part D as a standalone or a Medicare Advantage plan. You can check any and all boxes that apply to your conversation. There has to be at least one topic checked in this section, but most often there's more than one topic that you discuss during that conversation. Then you would enter your time spent in hours and minutes. So you can enter those times here. And then right here, once you enter information here, it's going to auto-populate into the total time spent, and it's going to convert it all into minutes here. And then the status, so is this still in progress? Do you have continuing follow-ups to do with that individual, or is this completed? Has the questions been addressed? Now, it's not saying that they can't call back in 2 weeks or you're just totally done with them. It's just that issue has been resolved for the time being, and there's no further follow-up needed at this time. Next, we have our special use fields. So specifically for our PDEO, Part D enrollment outcomes, the before cost and the after cost, which I'll talk about that here in a couple slides. That still remains the same process as we've talked about in the past, if you're familiar. So based on the plan details pulled from the Medicare Plan Finder, that original cost for them, and then the new cost of the plan. And then down below, we have the option to attach files. So you would attach the before plan details, the after plan details, as well as that enrollment confirmation. Also in field 3 here, we can also, if you needed to put the beneficiary's address, you could put that information there. These fields here are for additional uses, special use fields, but this 1 and 2 are specific to the Part D enrollment outcomes project, that information on savings and the information needed. Then in the notes section, you can type up some notes to provide additional details about those topics discussed. So it should expand on that information on the topics discussed and provide those additional details that are going to be helpful to you as a counselor, as well as maybe others who may be working with that individual as well. And then you would hit save down here at the bottom. And if you missed anything, it's going to, like I said, give you that error, give you that option to give you feedback on maybe what you missed. It's going to primarily be these required elements. It will tell you if you missed any of those required elements here in the system. So I'm going to go back to my slide deck here for a moment. And once again, additional guidance can be found in Chapter 4 of the STARS manual. There's also a lot of really helpful resources, job aids in there. There's a printable STARS form that, if you wanted to have a few on hand just to jot your notes down, maybe while you're working with beneficiaries, while it's fresh in your brain, and then go back and enter that information. Just be sure that if you do have any written information, that we're protecting that information, that when you're done with it, you're shredding it, you're getting rid of that information. As well as there's a really helpful job aid on when to enter a BCF versus a BAS. There's lots of previous webinars that were from the SHIP TA Center about entering client contacts, as well as there's a beneficiary contacts field guide with some instructions and helpful definitions of the different categories there in the contact form. I mentioned the MIPPA topics discussed earlier. So I can never quite remember all of these off the top of my head. I haven't quite gotten there yet. So I just wanted to give us a refresher, a reminder on what those MIPPA topics are. So up here on the screen, the Part D low income subsidy, the application assistance, application submission, benefit explanation, eligibility and screening, and LINET for Medicaid. Once again, benefit explanation, eligibility and screening, application assistance, submission, recertification, buy-in coordination, application assistance for MSP, and recertification for MSP as well. And then in the additional topics, details those preventive services. So once again, it's going to give you that reminder if you checked the MIPPA option and those boxes were not checked. And this chart here is actually found in the STARS manual, chapter 4, that I referenced on the previous slide as well. Then wanted to give us some reminders on the Part D enrollment outcomes, or PDEO. So you can reference the STARS manual, chapter 7A for guidance. So, it's kind of a guide, a reminder. Hopefully that is familiar to you. That's something that's been used for quite a few years. And I will show you where to find that when we go into the SHIP TA Center as well. It is the same process and the same required documents. So the PDF of the before plan details from Medicare.gov, the after plan details from Medicare.gov, and the enrollment confirmation. So those PDFs can all be uploaded into the STARS system in those upload sections that I showed you a few moments ago. And also, if someone's new to Medicare, what they're going to need is the PDF of the plan details and the enrollment confirmation. So it's just the two documents, and you would use the retail cost of the before price to show the cost savings by enrolling in a Medicare prescription drug plan. This is also true if their plan was eliminated. So that plan's no longer available to them. So it's showing that by enrolling in a Medicare drug plan, either Medicare Advantage or Part D standalone, that by enrolling in that coverage, that's the amount of money that they're saving. So if they were not to enroll in a Part D plan and they were to go without that Part D coverage, that drug coverage, then it's showing them how much they would save, because without that Part D coverage, it would be the retail cost. They would be paying out of pocket, right? So once again, in the SHIP TA Center, there's a lot of really great resources. I feel like a broken record here. I keep saying that, but it's really true. There's a lot of great things available there, wealth of information. There's a specific Part D enrollments outcomes section with specific details and resources to that reporting. So there's what they call micro trainings on that. There's the PDEO handbook, as well as some comparison guides and a step-by-step on how to report that enrollment data and savings as well. So I'm going to go back to STARS here in a moment, but the next thing I want to talk about is the search option. So for searches, you can refer to the STARS manual, chapter 6, where it has some step-by-step instructions and some guidance on how to conduct those searches. And once again, going back to that hierarchy piece, your role is going to determine what type of information you can search. So there are two available search options that you'll see there when you click on search. There's going to be a standard search and an advanced search. So standard search is going to be very simple searches. You're looking for very specific information, like a specific beneficiary contact to review before your next appointment. Maybe you met with someone 3 weeks ago and you want to go back and get a refresher on what you talked to them about. An advanced search is going to be broader, more complex data. It's more like a report. It can be exported into Excel. Those searches can be saved. that's where I would really reference the manual there, because it's a little bit complicated, but it can be done, right? You know, we can all do hard things. So I don't want to scare you away there, but it is nice because you can build those. So that way, if you have a frequently used search that you want to build that you're going to be running on a frequent basis, you can build that there in the system as well. So, once again, that STARS manual, chapter 6. You can also, in the searches, like you can, if you see up here on my screen, it says my saved searches. So once you have saved it, you can just go back to it time after time and kind of adapt it from there. As well as you can set your own dashboard options. So if there's things that you want on that home page that you have, that dashboard, that's adaptable too. So if there's specific information that you would like to have at a glance on your dashboard, you can play around with those settings as well to set it how you would like to have it be there on your home screen. Searches can be a little bit overwhelming. The first time I opened it up, I was like, wow, look at all this information. But wow, look at all this information that I can search on too. So you can look at it both ways. So for example, the beneficiary contact search, you can search by many different options. Basically everything in that contact form that I showed you a few moments ago, you can search by. So whether it's their first name or last name, maybe a phone number, a zip code, email, the opportunities are endless there. Reports are also available, but most team members don't have access to the reports. That's in the configuration tab there. So only program managers and state staff have access to those reports. And once again, based on the hierarchy, is going to depend on what reports can be run. But as an alternative, I think that advanced search option is going to be a good opportunity and going to give you probably what you're looking for anyways. I know I've had a couple conversations with our team members about running those advanced searches and being able to build exactly what you're looking for there for your teams. So let me hop back over to the STARS system. So once again, I'm just going to go back to home. And we were in the tracking inbox, which we'll go back to, but we're going to go over to search. So there's lots of different search options here. I mentioned you can set your own dashboard options, so you can check the dashboard, and there's different options here. Now, based on your role, you may not have all of these different options here, but you can do that. You can go to my saved searches. So I don't have any saved searches so far. Probably will in the future, but I don't have any quite yet. You can build those searches and go back to them. So as you've built them, they will show up here in this saved searches, as well as if you have any shared searches. So anything that is shared with you, you can utilize that as well. But down to the beneficiary contact, we'll just do standard search to begin with. So you can search by beneficiary contact or beneficiary additional sessions. We'll just go with beneficiary contact here. And once again, I told you that there's a lot of different options here, but I wouldn't let that deter you from utilizing the search option. It really just gives you additional opportunities, additional information to be able to search by. Probably your most common one will be that beneficiary first name, beneficiary last name, if you're looking for that information. You can also do multiple different sections here, so it doesn't have to just be one of these sections that you're searching by. You can do, if you want to do by the date of the contact, you can switch the search options here. So you can set it equal to, so it has to be today's date, or it has to be, March 10th. You can do that, or you can do after that date. So it was sometime in the last month that you talked to this person, but you can't remember the exact date. You can search by that as well to give you more of a broad range of the search options. You can search by who the session was entered by. You can do ship or MIPPA, yes or no. There are lots of different things that you can search by. I mentioned the STARS reference number. So if you have that STARS reference number and you specifically want to search by that information, you can do that as well. So lots of different opportunities, lots of different information to be able to search here. Oh,
Sorry
Katie, do you
to
have some?
interrupt. Could you make your,
Go
yeah,
ahead.
could you make your screen a little bit bigger by chance? Had a question in chat.
Let's see here. Probably. Sure can. Is that better?
Yes, that looks better. Thank you.
All right, perfect. Yes, so once again, you can search by any of these options, all of the options. I don't know, I think that would be a little too specific. Maybe just choose a couple of options to search by, and you can edit any of these as well. So if it's equal to, very specific, you know exactly what you're looking for, you want that specific item, you would use equal to. Or for example, if you're looking for a name, I think there's a starts with or ends with or a like option. So maybe you aren't 100% sure on the spelling, right? You can do the like option. So that way, if you don't spell it exactly how it is, it will at least give you those similar options to choose from. That way you can narrow down those results as well. And then also based on your role, based on your role in the hierarchy is going to depend on the information that you can search. So you can search at and below your level. So for example, program managers will be able to search their programs that they manage, where team members, you may only be able to see specific information that you've been linked to, that you've inputted into the system. So also, you can't edit other people's entries, so you're only going to be editing and looking at your own entries into the system here. So that's going to, so once again, based on the hierarchy of the system is going to depend on the information that's available to you, because getting back to that confidentiality piece, we want to make sure that we're protecting people's information and we aren't, and we're remaining confidential with that information that we're providing as well. Also, something I just wanted to point out that I didn't point out when we are in the client contact form, and I thought I had seen a couple comments come through about the Medicare.gov accounts. So there is not a section to put their Medicare.gov logins in here. And we ask that you don't put that information into the system. So that, once again, this is a system that goes on to ACL. So we don't want to be putting people's private information. We don't want to be putting that Medicare.gov login into this system here. All right, so let's go back to the searches here. I can show you a few more options. So we have you can search by beneficiary contacts. You can, actually, let's go to the advanced search option here. So you can build your own advanced search. This is going, and once again, you can save that. You can also just get back over to the standard search from here. You can save these. Once you have it built, I suggest saving it, even if you're feeling a little unsure of whether you're going to use it or not. Again, I would just save it just to be safe. That way you don't have to build that over again if it's something you may use a little bit further down the road. So you could do beneficiary contact, and then you would choose the different data elements that you want to pull out of that. So beneficiary, and if you click on something, it's going to bring it up in this operator section. And just like with the standard search, you can choose, do you want it to be equal to, so exact, not equal to, like. some of that information. The date of contact. So if you want to pull a data range, a specific range, you can do the between option. And let's say you want to pull all the data for your area from March 3rd until today. So you want to look at the last month's worth of data. You can choose that option there. And then you go through the tabs. So what do you want those columns to look like? What type of information do you want that to pull out of that date range? So let's say you wanted to pull the beneficiary first name, beneficiary last name, uh, beneficiary assets, the county of the session location. Let's say you want to pull who the session was conducted by. So you want to know who counseled, who conducted that session, and how much time was spent. And then you can adjust this as well. So you can go over here and you can sort it by ascending, descending. You can sort this however you want. So you can play around with lots of different data in here, lots of different information that you can pull based on the type of information that you need. So your organizational unit, it may look a little bit different based on your agency. So I have access to all of the agencies, but you would only have access to your own agencies. Once again, getting down to protecting that beneficiary information and making sure there's firewalls in between the different agencies, so we aren't sharing information that shouldn't be shared. As well as you can pull this information in different formats. So if you want it in a doc, an Excel file, if you want it to bring up in the same window or open a new window within your browser, you can set all of that information. And then you can put a title here, a name, and you can add a description. So kind of a reminder to you, not having to remember, okay, I titled it this, what is this search for? You can put a description of what type of information, or maybe an internal report that you have. You can put used for monthly data report due on such and such date, or however you want to word it. So once you have that, you can save it, and it's going to be there for you to go back to and to adjust as needed. So hopefully you find that helpful. I know there's been a lot of questions about that. Once again, I think probably for the majority of us, this advanced search option is going to give you a lot of really helpful, useful information that you're looking at when you're, managing your program, or even just looking for information on what's available there in your agency as well. So back to the search options. So I mentioned there's the group outreach and education and the media outreach and education. You can pull standard and advanced searches on both of these as well. So we'll just do a standard search. So group outreach and education. So if you're looking for more information about what type of outreach that your agencies have been doing or you've been doing, you want to pull that information, or you want to go back in and edit one of those forms that you have put in. Once again, very similar, the same type of information. Anything that's on the form, you can search by, and I'll go into these forms here in a few moments as well. Same with the media outreach. And with all of these, there's both a standard and a advanced option. So once again, you can set the different data points that you would like to search by, and you can pull that information and export that information as well. And don't worry if you're feeling a little overwhelmed. You can take it in chunks too. I would suggest that, take a few hours, take a little bit of time, maybe read some of the manual as well. I know the manual, not everyone has all the time to read through all 9 chapters, right? it's a long one. But even if you're feeling a little bit overwhelmed about something, you're feeling unsure about how to do it, I'll show you in the SHIP TA Center some really great resources that I know have helped ease some of my apprehension and helped me feel a little bit better. As well as we have the SHIP TA Center also has a STARS help desk. They are very helpful. I know they've been very helpful to me. I know many of you they've been very helpful to as well, in sharing some of that information and providing some of that guidance and expertise on where to find some of the things that we may be looking for that we're just not quite sure on, and providing some of that technical assistance. And it is a real person that you'll get. So there is a phone number or an email address. So whichever you prefer, if you want to talk to a live person or if you prefer an email, maybe you have some screenshots or things that you want to share with them, you can reach out to them at either one of those, and they are there to help provide that support and give you that information as well. And then down here in training, I'll touch on that here in a few moments. But for training purposes, for the training form, only our staff here at the state and the program managers have the option to enter those training forms. So I'm going to go back to my PowerPoints here. Back to searches. So once again, there's standard searches, there's advanced searches, and you can search by all of the different options, the beneficiary contacts, group outreach, media outreach, as well as there is a SHIP team member search as well. So that is mostly going to be for, once again, those program managers to be able to search for their SHIP team members. There is an activity form as well. So if you are entering activities, and once again, activity time is going to be time spent on the program, but not spent counseling. So things like shadowing, mentoring, data entry, that's all going to be entered underneath an activity. So something a little bit different. So rather than entering every activity as an individual entry into this form, it is a monthly basis report. So it is an accrual of all of the activities for the month. So let's say yesterday you had an activity and you started your activity form for April. Rather than, let's say next week you have a new activity to report, you wouldn't start a new activity report. You'll just go back in and edit that April report and add on that time spent and adjust the notes. So you would start by clicking on your name. It should look a little something like this up here on the screen. It'll say your first and last name, your state, which should be Michigan. It will list your agency there. Mine says Michigan SHIP. Yours will look a little bit different depending on the agency you're associated with, and it will tell you your role. And then up at the top, once you click on your name, it will give you an activity tab there. So all you need to do is click the activity tab, and then you would choose new. And what that's going to do is going to bring you to the next page here, which if you're a previous SHIP counselor, this should look pretty familiar to you. You would select the month, and that is a drop down. So you would select the month and the year. And then you would check the administrative support, or you would enter the time for whichever one of the options that you spent. So for example, administrative support, would be activities that support the day-to-day operations for the program. So things like data entry, maybe intake, some of those options there. Program management and team member support is going to be mostly agency and site managers. So things like volunteer recruitment, supervision, reporting, as well as the other tab. So other could be, or I shouldn't say other tab, other section. So mentoring, shadowing, or like on the job training, travel time that's not accounted for in other forms. For example, travel to and from a Counseling appointment should be accounted for in the beneficiary contact as well. And this is important because it does help us determine how much time is being spent on the program. So it should reflect how much time are we spending on this program? What does it take to run a SHIP program? Because once again, going back to where this information goes, it flows to the federal level, right? So it helps provide that support of what are we doing in our communities? How much time and effort does it take to run a SHIP program? So it may seem kind of silly to report some of that information, but once again, going back to telling our story, supporting our efforts, and supporting our beneficiaries on the time it takes to, and that report then goes on to Congress as well. So. Next, I want to talk about outreach and events. So you don't need to submit paper forms to us for the outreach and events. It's going to be directly entered into the STARS system through that tracking inbox that we've spent some time in. I did a brief preview of that, but there are printable forms available in the SHIP TA Center that you could use for internal use, or like I said, if you wanted to write those things down until you get a chance to enter that into STARS, but it does need to get entered directly into STARS and through the tracking inbox. And you would choose either the group outreach and education or media outreach and education. So group outreach is going to be things like, presentations, events, health fairs, things like that. Media is going to be like social media campaigns, email blasts, mailings, that media. You're reaching out through media. Group outreaches, it's maybe a live presentation, a virtual presentation. You're connecting with the community in some way, shape, or fashion directly. So to go back to STARS here, we're going to go back to the tracking inbox. And you would either choose new group outreach and education or new media outreach and education. So we'll just choose the group outreach and education here. You would choose the, oh yeah, go ahead.
Just jumping in here because I know you can't see the chat.
Yeah.
So just a couple requests in the chat if you're able to kind of slow back a little bit. I think there are just some folks trying to catch up as they're trying to follow along with finding the activity tabs and things like that. So
I took some things off of my dashboard just so I didn't have information out here. Let me go back and get to my own so that way I can show you what that looks like. Forget there's another Fleming, so I can't just search Fleming. Fleming. Okay. So here we are. Here I am, Jessica Fleming. And if I click on my name, so it doesn't matter where you click, it'll highlight in like a gray color. You just click and you will click. So it automatically goes to SHIP team member. You would go to activity and you would click new. And that's where you would find that activity form. So it may look slightly different than yours just based on your role there, but I believe everyone should be able to enter their own activities in here. Correct me if I'm wrong on that, Katie, but I believe it's everyone has access to the activity form. So once again, you would put in the month and the year, and you would enter the time in minutes that you spent in each one of these categories. And you can put some brief notes here, like, for example, let's say 4-3, spent time mentoring Sally Smith. Doesn't need to be long, it doesn't need to be a novel here. You can just put a short snippet about what that was that you spent the time on. Hopefully that helps clear that up a bit for everybody.
Yeah, thanks, Jessica. And yes, I know we've got some questions in the chat regarding activities and some other things too, which we will come back to the questions as we after we finish up this presentation, just so you all know.
Yep. Thanks, Katie. All right, so back to our group outreach. You will, once again, enter the date, and if it's MIPPA related, so once again, going back to those MIPPA topics that we talked about earlier on, if it's related to any of those topics, you can check the MIPPA box here, the time spent, the title, the type of event, the method, the number of attendees, the zip code, the county, if you have an event contact. So once again, the ones with the red asterisk here, those are the required elements. And then the intended audience, the target beneficiary group, as well as the topics discussed. So what was the outreach about? You can also attach a file here that is going to, if you have a flyer or any additional information you'd like to attach, you can attach those files, as well as enter any notes that you would like to put in here as well. And once again, this is searchable. You can search this information and go back to that as well. So, and the same with the media outreach. It looks pretty much exactly the same as what we just reviewed. So I won't go through all of these again. So you would enter the information. The red asterisks are going to be are going to be the required elements, as well as the intended audience, those topics discussed. You can enter notes, and you can attach any files that you have related. So if you have maybe a flyer or a copy of the social media campaign or whatever it may be, you can attach those files here, and then you would click save. All right, so I think that brings me back to my PowerPoint slide here. And I did see a comment for going back over the activity form. So if there's a little bit of time at the end, I can try and do that, but I just want to make sure we get through all the good stuff that we have to get through today, and being respectful of people's time too, because I'm already taking 2 hours out of your day. So training tracking. So I mentioned this a little bit earlier. So only state level and program managers can enter training forms in STARS. So what that will look like is for local training. So any local trainings, program managers will enter that training in the training form. And for any statewide training, so things like today, we as an MDHHS will enter the training form. Guidance can be found in Chapter 9 of the STARS manual regarding the training form, or there is a printable form available in the SHIP TA Center as well. So if you wanted to use that internally within your agencies for tracking, that is available as well. All right, so next I want to spend some time on the SHIP Technical Assistance Center, or the SHIP TA Center. You'll often hear it referred to as. It is a national resource available to all SHIP programs, all SHIP counselors, and as well as SHIP trainees. I want to talk about a couple of different elements within the SHIP TA Center, and then I'll go through and show you where some of these elements are found, and show you where to find some of this information as well. So I wanted to start off with the training manuals, the training component of the SHIP TA Center. So there's a couple of components to it. So there's the training aspect of it, the training modules and testing, as well as a resources section. So there's a couple of different elements here. So you'll often hear us refer to the training and certification. The OCCT is what it's referred to as, or the Online Counselor Certification and Training Program. It's going to be a bright green button up at the top of the screen that I'll show you. It is a series of modules that we're going to use for initial training. So those initial modules, those prerequisite modules for new team members, to get that groundwork of, what is Medicare and how does it work? How do you sign up for Medicare? What's Medicare Part A? What's Medicare Part B? What is Part D? It gives you that groundwork. Then will be expanded on within that initial training classroom portion. As well as anyone can take them. You don't have to have my permission to go in there and take those modules. I know I've gone through them. I know quite a few people have said they've gone through them like as a refresher. So have at it as you will. You're more than welcome to take those modules, to look at them once, as many times as you want to. They're available there for you as a opportunity. As well as the unique ID recertification that's been happening. There's a privacy and confidentiality course that's available in there that does qualify towards that training element for that annual recertification for the CMS unique ID as well. So what about Michigan specific materials? So we're working on a learning management system to house more Michigan specifics, like webinar recordings and information, as well as we'll talk about a little bit later on a SharePoint website to house some of that information to make it accessible for everyone and easily accessible for everyone as well. There's also the ability to build and administer tests within the SHIP TA Center. So examples, recertification, which I'll talk about a little bit in a few slides here, initial certification, and more as we need it. So I do have the ability, or we have the ability, to design and assign those exams that are available in the SHIP TA Center, as well as create our own. So there's some quizzes available in there already, but also we can adapt those and create our own as well. There's also resources available there. So I'll go through the resources tab and show you where to find some of the things that I've been talking about. But they are national and state submitted resources. And it will tell you on the resource where it came from. So it will note who submitted the resource. And there's lots of valuable information found here. The SHIP TA Center does a good job of providing information and guidance and resources, as well as recordings of their past webinars to access there as well. So there's job aids, there's newsletters you can sign up for, there's webinars, lots of toolkits available based on specific subjects, as well as the Medigap Plan Finder tool. So hopefully you all are familiar with the Medigap Plan Finder. I know I've had a few folks ask me about that. It is the same tool that we've been utilizing, that was utilized in SHIP tools that was linked there. since that is maintained and housed by the SHIP TA Center. So that is the same, that same tool is still available to all counselors to help find information about those Medigap plans for beneficiaries. And then just a few notes on accounts for the SHIP TA Center. So all current team members can request an account. So if you haven't done so, I encourage you to do so. It is shiphelp.org, which I believe I have that linked into the resources here at the end. And then once we get that request, so Katie and myself get those requests, we cross-reference stars to verify they're an active team member before we approve. So we have to make sure our systems are matching. So just like in stars, there are roles associated, there's a hierarchy associated with what you can access. So as a SHIP trainee, you would have access to that online certification and training portion. So kind of to get started, access to those online trainings available to you. There's also SHIP counselor is probably going to be what most of us are classified as well as SHIP staff and SHIP administrator. So I do ask that you don't use SHIP administrator because I'm going to have to come back to you and say, hey, I had to delete your request and can you do it again as a SHIP counselor? Because I can change SHIP trainee, SHIP counselor, SHIP staff, but at the SHIP administrator level, that can't be adjusted, or at least I can't. I think maybe Katie can, but it's more difficult for us to adjust that. So we do request that you don't use the SHIP administrator option. You use SHIP counselor, SHIP trainee, or SHIP staff, because SHIP administrator is going to be utilized for us here at the state, that state level, that administrator level of the TA Center system. So if you're a new team member, what we would need first in order to get you access to the SHIP TA Center is going to be a new team member application, as well as proof of background checks. So we need to be able to enter you into the STARS system, make sure we have all the checks and balances there before we can give you access to the SHIP TA Center, because it is only available to SHIP team members and those and staff. All right, so before I move on to recertification, I am going to go ahead and pop on over to the TA Center. So I mentioned here that you can request an account. So actually, I'm just going to go to shiphelp.org and show you it from there. So this is shiphelp.org. So this is, once again, a national website. There's lots of information for the general public here on this site, just about SHIP programs and information about volunteering and finding local SHIP programs. So not only do we use this site as counselors and as SHIP programs, but also beneficiaries may be utilizing this website as well. Because if you were to click this SHIP locator, it's going to give you all of the different SHIP programs, and you can, based on where they live, let's say you're looking for a different program, you receive a call and it's from someone in New York, you can click there and there you have access to the SHIP program for New York. But if you go to SHIP login up here at the top where it has the little padlock up here, that's going to bring you to the login page if I wasn't already logged in. So I'm just going to go ahead and log out here just to give you an idea. So back to the page that I had originally pulled up. So you can, if you don't already have a login, if you're not a registered user, you can submit a request to be a registered user. And you would enter your information, first name, last name, your email address. And once you do submit this, it's going to shoot you an email and it's going to ask you to confirm your email address. So make sure you're on the lookout for that. And you would create a password. You would enter the organization in which you're with, your title. You can enter your phone number. You'll need to enter your city. Once again, back to the roles I talked about earlier. So ship trainee, ship counselor, ship staff, ship administrator. I ask that you use either ship trainee, ship counselor, ship staff, so that way I can adjust that if you're feeling a little unsure about which option it is. If you click one of these three, I can adjust it once I get that. And your state. So you would select Michigan from this list. And you can put a brief reason for the request here. So, whether it's maybe new ship counselor seeking training for initial training, whatever it may be, you would enter that information, or current ship team member, whatever it may be, and click register. And once you click register, once again, that email is going to come here to us, and we will cross-reference and make sure that we have all the information needed. Like I said, an application, proof of background check in order to grant access to that account there. So I'm going to go back to here. Hopefully I'm still logged in. Nope. So I'm going to go ahead and log in here real quick. Just give me one brief second. And your login, your username is going to be your email address. All right, I'm in here. So, whoop. So I mentioned, so this is going to be your home page, your welcome page. It's going to tell you your name, in case you weren't familiar. And it's going to tell you up here in the right-hand corner what your role is. So we can see here that I'm a ship administrator. It's going to give you access to the training and certification, the OCCT that I mentioned earlier. We'll hop on over there here in a bit. As well as it's going to have your, this may look a little bit different. I don't think everyone has this dashboard option up here, but most of these things should show up for you. Unless you are a ship trainee, then you would have limited access to some of these things until you go through the initial training process. So once again, the Medigap Plan Finder, hopefully most of you are familiar with that tool. This is going to be available to everyone. You just click to open up that tool here. There we go. So you can still utilize that ship or that Medigap Plan Finder tool here. It's item number 1 on this list. There is a very comprehensive resource library where you can search for information. Needs a minute to think about it. There we go. So it's going to automatically give you the most current options. And you can search by keywords. You can do recently updated, recently added. You can search by dates. So you can add different filters. You can search by subject. So if you're not really quite sure what you're looking for, but you're looking for information about Part A covered services, or you're looking up for information about ship promotion or outreach, there's a lot of different filters that you can utilize here to narrow down some of those searches. So there is the option to upload resources. However, that will come here to us to approve. So generally, if you have something that you think should be in the Resource Center, reach out to us, but it's not just going to automatically go into this resource library here. And I remember I talked about earlier that it will tell you where the resources came from. So we can see here, this one came from Illinois. This one, if it says center, that means it came from the SHIP TA Center, the SHIP Technical Assistance Center. So it's going to tell you where all of those resources came from. We have the STARS resources. So I spend a lot of time in the STARS resources. I have found it immensely helpful. It splits it up by topic. So it's page 1 is just going to give us some general information about STARS that we've gone through today, as well as the link to STARS, the stars.acl.gov, where you will log into the STARS system. You will have to enter your separate login from the STARS for the STARS system. There's a news section that if there's any updates or information about that, you can look there. So that will stay updated. Get help. So if you're having troubles with STARS, you're looking for some of that technical assistance. Like I mentioned earlier, there's the SHIP TA Center. They have a help desk. You can call for one-on-one support, and that is 8 a.m. to 4:30 p.m. Central Time, Monday through Friday. Or you can also email them as well. Or if you are locked out of your STARS account, you've tried your password too many times, you had too many failed attempts, you can contact Booz Allen Hamilton, and they will help you reset that account. You can either email them or you can contact them by phone once again. Then it gets into the bulk of the information. So getting started with STARS, there's a really great STARS 101 course that I highly recommend, and some great infographics. It will give you links to the different chapters of the STARS manual based on the information that you're looking for. Can go into beneficiary contacts. So there's a STARS beneficiary contacts course. There's some micro trainings, some short snippet trainings that they have available about entering beneficiary contacts. Once again, that STARS manual, chapter 4. Different handouts, job aids, infographics that are available, as well as the different webinars recordings that are available as well. So I find this very helpful when I'm looking at a specific topic, looking for more information on that topic and where I can find some of that information, or some of these short infographic snippets are also very helpful as well when we're looking for more information on what we can use. The Part D enrollment outcomes mentioned earlier, a few of these. There's a PDEO handbook. There's the Chapter 7A, lots of different information that we can refer back to when we're looking for more information about some of this as well. The training form. So, I won't go through all of these, but you can go through each one of these different topics and browse the information that's available, and it will give you links to the different applicable resources that are helpful when you're looking for information about that. There's also some, if we refer back to here, the toolbox, there's different toolboxes that are available for us as well. Some of these are mostly applicable to some of the manager roles, like coordinating volunteers, counseling, managing your program, professional well-being, lots of good information here. So some of these may be a little bit more limited based on your role within the TA Center. There's news and events. So once again, there's a whole wealth of information here. And, as we continue down this path, as we get more and more familiar with some of this information, hopefully we become more familiar with this. I know, it's kind of taken me a minute too, to get used to where things are located and where to find information. But, my advice to you is to kind of to start here. If you're feeling a little confused about something, maybe you have some questions, you're looking for some more information about the topic, this is a really great place to start and to look for that information, as well as those manuals for the STAR system as well. So now I'm going to hop on over to, I should also add here, you may notice this little heart up here at the top. So if there's some things that you use quite often, you can click this heart button up here at the top, and it's going to add it to your favorites list. So over here you have my favorites. So if you're frequently looking for, the manual, maybe you want to save the manual in your favorites, you can click the heart up at the top, and it's automatically going to go to your favorites. So if I were to click on my favorites now, it's going to show up here as well. Then the training and certification. So no matter where you're at in here, it's always going to be up at the top here. And we can go to the training and certification, OCCT. And we can go to courses. And that's going to give you all of the courses. So it's broken down by levels, by topics. So Medicare basics, Medicare coverage, and you all have access to any and all of these. So please, by all means, feel free to take any of these courses you would like. If you click on the course, the plus sign, it's going to give you a brief synopsis, a brief review of what it is, details about it. And then if you click Start Course, it's going to take you to the course. So you can, just by clicking this play button, it's going to start that online module. You can also test your knowledge. There's quizzes associated with these, as well as if you click the plus, there's course materials. So some of them, it's going to be a slide deck associated. Some of them have case studies and additional materials and job aids associated. So once again, lots of very helpful information kind of to get you started on some of these topics or give you that nice refresher as well. And then we also have the certification tool. So that's going to be where you find the tests. Mine looks a little bit different because I can see who's taken the tests and the results and whatnot, but me as the administrator, I can assign you the tests in here. So you'll see the SHIP counselor recertifications in there. So that kind of leads me into my next portion of, and once it's assigned, it would show up in your exam list, and you would click Take Exam to open that exam up. And so that leads me to my last bit here about the annual recertification. So part one of recertification is today's webinar. I wanted to use this as a kickoff to give everyone that information about what's going on here in Michigan, give you that overview of those tools and resources that are available. And then part two is like a Medicare 101 Medicare Basics exam that we pulled out of there are a list of questions available through the SHIP TA Center. So I utilize the Medicare Basics to hopefully give us an easy exam to kind of kick us off here. And our time frame that we're looking at, I'm going to start the recertification on April 10th. So give us a week to get materials distributed, get your attendance reported, get some reports out to those program managers. That way we know who needs to take the exam. I'll be sending out updates on where folks are at with their recertification. So who is going to be required for this is going to be any team members who are certified in 2024 or prior. So if you certified January to now, you don't have to do it. Now, if you'd like to, you're more than welcome to complete it. If you just want to do it as like a a test, just for fun type thing. That's okay with me. Just let me know and I can get you added to that list. But you don't have to. So once again, it will be assigned to you in the SHIP TA Center, and updates and reminders will be sent out to those program managers as well. And then a few last thoughts here, kind of on the horizon, things we're working on that are coming up in the future. So I mentioned this a little bit earlier, and maybe Katie has a few things to share about the SharePoint and the learning management system, but those are things that we're working on to get you access to things like a resource library to share information, view recordings, some interactive pieces for that SharePoint site, as well as a learning management system to house those specific trainings and webinar recordings, maybe some more specific to Michigan modules that we can create and upload there, as well as we'll continue to have update trainings and initial trainings and communicate out information to you all as we move forward down this path and continue our work here with our Michigan beneficiaries. As well as I have our resources section here. So some links to, the STARS manual, the user roles, and lots of helpful information that I've referenced during today's presentation here. Katie, do you have anything that you wanted to add here before I open it up for some questions?
No, I think you covered it all. Yes, I know we have lots of questions, so I know folks are probably eager for us to get to those. So I'll let us dive into that.
Great. Well, let's go ahead and dive in. Do we have some questions we want to, maybe some frequently asked ones?
Yeah, let me pop over to those here. So yes, there were some questions regarding sharing out these slides. We will be sharing those out with everybody. So just a heads up on that, and Jessica, I'll let you kind of dive into that component of what we're sharing out. There were questions regarding, and I think maybe you already answered some of this, the co-counselor component, Jessica, and STARS.
Mm-hmm. Yeah, so you can, so there's not an option to assign a co-counselor. So if you are wanting to account for maybe some of that mentoring time, that co-counseling time, you can do so in the activity tab. But something a little bit different is that we've talked about in some of the meetings is, instead of assigning just a flat number of hours to that initial certification, as far as that mentoring time, that co-counseling time, it's going to be up to the region and kind of a communication, or the agency and a communication between the counselor and the agency to determine when they feel ready to go forward and do that solo counseling, so to say, rather than assigning like a set 18 hours. It could be less, it could be more. It's going to depend on, we kind of recognize that some folks are coming into this with years and years of knowledge and experience in counseling and Medicare and Medicaid, while others, maybe this is a brand new subject to them and they need a little bit more time to feel more comfortable before they start taking their own clients and providing that solo counseling.
Thank you. There are questions here. And then I think there were just sharing out the recording. We are, as Jessica mentioned, working on a SharePoint site for kind of things to live, resources to live, like this recording. We will share it out, but I know that there's been some challenges with some of our recordings in the past. So just a heads up on that. We will try and share that out along with the slides, however. So you have those. Just kind of scroll along here. And I don't know, Jessica, if you're going from the top of the questions, but if you are, feel free to answer the ones. Some questions about, a lot of questions around reporting and pulling reports out of the STARS system, including like kind of specific reports. So I think maybe we could answer some of those in like an FAQ to share those out with you all.
And I think
yeah, go ahead.
referencing the STARS manual is going to give you a lot of guidance on some of those more specific reports that you're wanting to pull and what reports give specific information, as well as the SHIP TA Center helpline as well. If you're feeling stuck, if you're not sure, you need a little bit more guidance, they're always available to help guide you on some of those elements as well.
Gotcha, thank you. But yes, I think because there were so many specific report requests, maybe unique to some specific counseling sites or counseling type sessions, we could try and share out how to pull like those reports or where to find that information. There's also questions on obtaining and maintaining a unique ID. I don't know if we want to, if you can address that. I know we talked about the 120-day rule, but I guess if you're new to obtaining that, if you wanted to share that information.
Yeah, so once again, you have to report at least every 120 days, or else it's automatically going to deactivate that unique ID. Now it can be reactivated at a later date, so it's not like if you lose it, sorry about your luck. You can get that back later on, but you have to have a assigned confidentiality agreement that you would work with your agency program manager to obtain, and the two of you would have to sign that, as well as the privacy and confidentiality module in the SHIP TA Center must also be completed. So you have to have those elements in place in order to request a CMS unique ID. And then us here at the state level would go into your STARS account and request that you be assigned a unique ID, and you would get an email with that unique ID information once that's been assigned to you. So those reports go to CMS, I believe, the third or fourth week of the month. Don't quote me on that. But there's a specific time of the month that those reports go out to CMS, and then they will assign you a unique ID, and you would receive that information in an email with that unique ID number and the information that you would need to be able to utilize that.
Great, thank you. There were some questions around the BCF versus BAS, and I think there is like a cheat sheet in the manual, if I remember correctly, and we can try and share that out along with this webinar. In addition, there are paper forms that are available. I don't know, but I think there was a question in the Q&A about that, so we'll try and share that out as well. There is also a question about CEUs for this webinar. We didn't have that connected to anything CEUs wise, just anybody who asked that. But however, we are happy to share an email or something if this might count for some certification training for you elsewhere unrelated to this. So just wanted to share that note. You're welcome to reach out to Jessica or myself, and we're happy to share that. And I just am going to just address that I I'm trying to, there are some similar questions, so I'm trying to grab those together. Like I said, we will compile them and put it in an FAQ to email out as well. And I also recognize that we shared a lot of information in one very short webinar, and that there are quite a bit of pre-recorded webinars. So we want to make sure you guys will, you'll have access to those in the TA Center. So, please utilize those, but this won't be the only time you ever hear from us. So we'll continue to kind of share this information. We're just trying to get some very high level and also detailed items out to you all as well. But let me keep going here.
Yeah, this won't be the last time you hear from me. There will be lots of opportunities.
Questions on kind of filtering out resources in the SHIP TA Center. Do believe that on the when you're in the resources, there should be a filters tab to either filter by state, or you can search that. So just a heads up about that if you're trying to do that in the TA Center.
Absolutely. There's lots of filter options that you can utilize to narrow down your results.
And then someone asked if you're looking to get an account, what you put for your organization. That would be the organization you're counseling on behalf of. So that would be what you're gonna select or write in rather when you're creating that SHIP TA Center request account. Excuse me. Yes, we can put the help desk. I don't know if it's on the past resources. There was a question about help desk information. We can try and pop I think you're asking for the Booz Allen Hamilton help desk. I'll try and pop that in the chat real quick for stars. Or if you want to drop that in the chat.
Yeah, you can go back to the page that had that information.
There's some questions regarding just quickly about the exam. Jessica, if you wanted to talk a little bit about that, of just if this information is encompassing on the exam or if that is maybe separate information. I know you shared the on the presentation. If you want to just talk a little bit more about that, if you could.
Sure. So it is like a Medicare Basics, a Medicare 101 type exam. And what I could do is I could share out like maybe like a copy, it's not going to include the answers, right? But kind of like a study guide of those questions to kind of help you prepare for that exam. I should have wrote it down. I think off the top of my head, I think it's 20 questions. So, once again, there's a lot going on this year. So we tried to keep it as simple as possible and just utilize this as kind of a jumping off point, a starting point to get us prepared for the year ahead.
So were those asking kind of for the test or the quiz ahead of time? It's more specific on kind of that 101 stuff, not necessarily the tools and things here.
I tried to pick very easy questions. So I tried to avoid any too complicated questions. I tried to keep it pretty simple this year. I'm just plugging into the chat here the STARS help desk and the Booz Allen help desk. And that's both the email and the phone numbers.
Great. And I know we've got just a minute left here, so I'm going to try and there are as a geographic regions of which agencies are serving what. We'll try and share that out as well, so you guys have a copy of that. And then there was a question just going back to STARS. If you have two of the same contacts, is there a way to delete the ones you don't want? Yes, there should be a way to delete that in STARS. I
believe that would have to come here to us at the state level because users can't delete data.
Thank you. And then they're just finally, I think we talked a little bit about this already. And again, we're copying all these questions from the Q&A, and I did not quite get to all the chat, but about the addresses and Medicare.gov. So for addresses, you could put those in the special use fields, special use field 4, I believe, in stars for the client contacts. Medicare.gov ID, excuse me, and passwords, we do ask that you not maintain those there. You are welcome to work with your organization and their client management software to maintain those for now. But we are, it doesn't allow us in stars. They ask us not to report that information in there, as Jessica kind of mentioned earlier. And then I do, yes, see a couple other questions, but I know we're at 3 o'clock, so I want to recognize that, but we're going to compile those and put them in a FAQ and can respond from there. So hopefully you can all see them after. And I think we got through hopefully quite a few of them through the webinar, which wanted to be able to get you that content. I guess, Jessica, anything else you want to share as we wrap up here? Because now I realize we've taken over 2 hours of folks' time.
No, I just want to say thank you. Thank you for joining us today, and looking forward to many more webinars and presentations and helping serve you all and our Michigan Medicare beneficiaries. And thank you for taking the time out here with us today, and we'll be seeing you.
Thank you, guys. Have a good one.
Thank you.